Hi, this is Wesley Walker, former All-Pro wide receiver for the New York Jets. Stay tuned for Bridge to Health right here on Long Island Public Access Channel 20.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Hi again, welcome back to the Bridge to Health. My name is Dr. Tom Dow, and each week we have a special guest from a different healthcare discipline that most of the time is part of our team of healthcare providers to give our patients the best possible care we can offer. Many times, stress is overlooked as a health concern, where stress many times is the major health concern and the cause of many physical problems as well as mental problems. Today, we have the honor of having Bina Benesh, MSRN, who's a mental health care professional. Hi, Bina. Thanks for joining us on the show.
My pleasure.
So, Bina, you have a very interesting field. Where were you trained?
Well, I was trained actually in mind-body medicine at the Benson Henry Institute of Mind-Body Medicine, but I first had a Master's of Science in Mental Health Counseling. I have a private practice as a mental health counselor, psychotherapy, and I work with patients, a lot of infertility patients. And my specialty is, again, more in mind-body medicine.
Tell me a little bit, and tell the audience a little bit about what is mind-body medicine.
So mind-body medicine is the field of medicine that uses the processes of the mind to influence the health of the body. So it really consists of treatment methods where they take into account mind-body interaction.
Okay, so I think that kind of goes along with a lot of work has been done with biofeedback. Patients who are stressed and their psychologists help them to lower their pulse rate by certain thought processes, lower their blood pressure. Basically changing things physically in their bodies through their mind.
Exactly.
And concentrating on those parts and making changes. Is that right?
Exactly.
Cool. Okay. So is this similar to like you see these like gurus and these Indian guys that are able to stay like in a hot box that it's like 120 degrees and they alter their whole body chemistry or they would die? Is that
Yes, I'm glad you asked that question because I was going to say that once I explain it, I wanted to say you do not need to be a guru or a yogi or an enlightened Tibetan monk in order to learn the methods of mind-body medicine. Although that's the root of when Herbert Benson did this work, that's where he obtained all that information. He actually went to the monks who were able to dry their wet cloths just by their body temperature, and he learned so much about mind and body through them. But no, you do not have to be, it's nothing mystical.
Well, you know, I'm a personal testament to that. Years and years ago, I brought my mom, who at that time was probably 65, to an event in Manhattan, which was the Firewalk experience. Tony Robbins?
Yeah.
And we actually, after 4 or 5 hours of preparation with Tony, of how to control our minds, anchors, how to protect our bodies, we actually walked across, and no one would believe this unless they actually saw it, a 15-foot bed of hot coals over 2,000 degrees barefoot without even getting a blister.
Just from learning.
Just from preparing with my mind,
Yes.
or our minds. And after my mom got to the other side, she looked at her feet and she thought she was hypnotized and really didn't walk across. She couldn't believe it. So the power of the mind is phenomenally strong. We don't even probably know how strong it is at this point.
It is,
right?
and especially when we talk about stress and anxiety, particularly when I work with a lot of fertility patients, and there's chronic stress with that. But with mind-body medicine, taking that all into account, we know that what happens is whenever we experience stress, you know, the way our brains are wired, years ago, if you were confronted with a saber-toothed tiger, you know, the brain is going to release stress hormones. This is all part of the sympathetic, fight or flight, sympathetic response. And what those hormones will do, you know, adrenaline, norepinephrine, cortisol, what they will do is instantaneously cause, you know, increased heart rate, increased breathing rate, increased blood pressure, increased blood flow to the major muscle groups in order to help you either take flight or fight.
Right.
This is great if you run into a bear or a saber-toothed tiger, but in this day and age, when people are struggling with day in and day out stress, especially with infertility.
Especially in New York.
And especially in New York. And you often don't even articulate the fact that you're stressed because it's just so part of your life, you don't realize it. But what happens is the brain continues to release on a chronic basis these stress hormones. And we don't realize that. And these stress hormones have these effects, as I just mentioned, on the body. They have an effect on the immune system, on the digestive system, and on the reproductive system. So mind-body medicine works in that we teach techniques to elicit what we call the relaxation response.
Right.
And what that is actually the opposite of the physiological stress response. The relaxation response is actually a term coined by Dr. Herbert Benson, who is the founder of the Mind-Body Institute at Harvard. And what the relaxation response is really your personal ability to encourage your body to release brain signals and chemicals that are going to slow down the organs, the muscles, increase blood flow to the brain. This is the opposite of the sympathetic
and
nervous.
decrease the cortisol and the stress hormones, which are detrimental to our bodies.
Decrease the stress hormones and bring you back to pre-stress levels. When the body is experiencing that, the body is in a more centered, calm, even state, and there's the mind-body connection, so it works together.
So now let's talk about where you specialize in this mind-body connection work, and that is within fertility practices.
Yes.
So I would imagine that probably one of the most stressful things in life, or one of the higher stressors in life, is a person having difficulty becoming pregnant, being able to have children. What kind of stresses do these folks go through on a daily basis?
Yeah, well, infertility is a major life crisis. And as many as 15% of couples of childbearing age experience infertility.
Wow, I didn't realize that it was that high.
It is, and what I find most astounding from all these statistics is that the majority of infertile women report equivalent levels of anxiety and depression as do women who have been diagnosed with cancer and HIV.
Wow, that's pretty intense.
Yes, it's pretty astounding. There is, you know, once someone is diagnosed for whatever reason with infertility, and there can be many reasons, but once that diagnosis is made, it's a shock.
Right.
No one expects to ever have been in that position. And when that occurs, there's a myriad of emotional responses, and you know, the woman can begin to experience feelings of sadness, depression, but anger and rage also, resentment, confusion.
Like, why is this happening to me?
Why is this happening to me?
Right.
Which also makes them question their spirituality. You know, I've been a good person all my life, but what have I done? You know, was it when I did this or when I did that when I was a teenager? You know, am I being punished? When in fact it is none of that. But what they also experience is a lot of feelings of isolation and loneliness, especially social isolation. And part of the reason for this is it is difficult for them to communicate with friends, family members, co-workers, because although those people want to be a support system, and they say things in ways that they think they're being helpful, giving some advice, asking questions, most of the things that people say, if they have not experienced infertility, the woman who is infertile perceives as being wildly insensitive.
Such as what? What kinds of things would somebody typically be offended by if they're infertile and their family's asking them things?
Such as,
what are the no-nos not to ask?
Yeah, don't say to the person, "Oh, just relax and have fun and you'll get pregnant." Don't say, "Oh, go out, have a few drinks. Have a few drinks, get drunk, that'll work."
Right.
People say the craziest things, and what I tell people, if you have a family member, a good friend, a colleague, who that is going through this, the best and most honest thing you can do is ask them, "What can I do to help you?" And as an infertile woman, you can tell these people what it is that you need and what it is that you do not want asked.
Right.
People may ask questions when there is so much involved in fertility treatment that it is hard enough for the infertile patient to comprehend herself as she's going through this. So if she has to explain this to people, it's going to be very difficult.
Yeah, and plus I'm sure with the many different social situations that they may be invited to or be in, that sometimes they just don't want to be around kids, they don't want to be around families that have kids, and they might feel as if they're insulting people if they don't go, but they might not feel comfortable,
and
right?
it's a dilemma because this exact issue exacerbates their withdrawal and their feelings of social isolation because they can no longer, it's going outside of their house, this is all they see. They see pregnant people, they see people their age who are talking about having children. People ask them, "So, when are you having children?" And that seems like an innocuous question. It really does.
It's got to be very hurtful.
It's a knife through their heart.
Yeah. So, with women who have been diagnosed as, quote, infertile, and I'm sure there's many women that were diagnosed infertile that eventually became fertile.
Mm-hmm. Yes.
But what do? You work with them to help them relax and decrease these stressors that are out in the environment and teach them how to maybe coping skills on how to deal with those things?
Exactly. What we do is, and it's not only the women, it's the couple. So with women, where women may experience the cycles of negative thoughts, men also have feelings about this infertile diagnosis. Now, it doesn't matter if it's a male factor, a female factor, or plenty of infertility is unexplained, okay? So that doesn't matter, but whatever that is, men can feel somewhat isolated, inadequate, and speaking about their feeling of inadequacy, and this is even if it is not a male factor, sex becomes a job. So making love and sex is no longer part of expressing intimacy and love or even fun. It's certainly not fun anymore. Sex has become a job. And believe it or not, many men feel like they're being used for their sperm.
No, I believe that because I've actually seen TV shows and movies and things, and you see young couples trying to get pregnant, and they're usually comedies.
Right.
And you see the woman with her clock and her timer, and all of a sudden she goes, "Let's go, let's get in the bedroom,
Right.
It's time,
Right.
I'm ovulating." And that's got to be very stressful for the man or the couple to have to be on a time clock.
Exactly, exactly. And you can imagine if you've been going through years of this, years of trying to conceive, and this kind of interaction has so many ramifications on the relationship. It makes it really difficult. So, yeah, we encourage a lot of communication, but also I wanted to say that there's something we call the gender gap between men and women, as far as their experience of infertility. And
What is that? What is the gender gap?
the gender gap is the way they feel. Women, the emotions that women experience that surround infertility are emotions of loss, profound loss. There is grief over the loss of their primary role in life, which is that of being a mother. There is grief over the loss of a pregnancy and grief over the vision that they have had of their lives. So, and when I say loss of pregnancy, what I mean is they don't even have to have had, let's say, a miscarriage, a physical loss, and that's what makes it so difficult, because this is a loss.
Do they feel it the same?
They feel it the same. It's not seen by other people, but for them, month after month, each month that they try to get pregnant and they receive a negative result, it's devastating, and it is experienced as a loss of another pregnancy.
Wow.
So these are a lot of emotional losses, and with men, they don't experience this as a loss of their primary role in life. So that's kind of the difference. And of course, this sounds like a generalization, and it is, but speaking from what patients have told me, you know, men have many negative feelings about fertility issues. But loss of their primary role in life is not one of them. So that's one of the gender gap feelings.
That's very, very interesting. So what you're saying is that a man has things that are more important than having a baby, or is that what
I'm
as opposed to a woman, that's the main thing?
Even women generally, no matter what they become, little girls become women, and no matter what they do with their lives as professionals, most women have always intended to become a mother. And we have seen that as our kind of primary role, even though we have other, let's say, primary roles. But for men, it's more of a loss of a secondary role, that of being a father, because for many men, their primary role is usually seen as working, whatever their work is outside the home.
Okay.
You know.
Okay. So I have a question. So with your work with women that have been, quote, diagnosed infertile, have you had women that, through your work and I guess other things they've been doing at the same time, nutritionally, lifestyle changes, have been able to become pregnant?
Absolutely. What we have found, well, first of all, the women that I work with, when we utilize mind-body medicine techniques, we found that this reduces mood symptoms such as depression, anxiety, anger, feelings of isolation. It also reduces physical symptoms such as fatigue, headaches, pain, insomnia. Many of the women who have been my patients or been participants in the Mind-Body program have reported that they feel more in control of their lives now, that they can cope with feelings in a more constructive manner. They feel less negative about their life, and their self-esteem and their self-worth has really risen out of the gutter. And a lot of this is due to having the ability to speak with people who are, you know, in the same boat, but it's also, I always teach them, we do about 20 to 30 minutes of a relaxation technique, whether it's meditation, breath work, we teach mindfulness, we teach progressive muscle relaxation, but through all of this, the foundation of that work is all breath work. So when I said you don't have to be a yogi or a guru, what I'm saying is you don't need to have been a meditator.
Okay.
Anyone can learn how to do
learn the technique.
The technique, the breath work, which will change the physiology in the body.
So with a woman, let's say, where it's a case where they don't know why she's infertile or he's infertile. They just know that they got this couple, that the male has a normal sperm count, the woman physiologically changed, it turns out fine, but they just can't seem to conceive. Have you found that the stress of not being able to do that can be the only cause of not becoming pregnant? Has that ever happened before?
Yes, I think it has happened. I don't like to tell people that their stress is causing their infertility, because the last thing you need is to start feeling stressed about your stress.
Right.
Stress can affect your infertility. We know that the stress hormones can inhibit the release of the reproductive hormones. It can affect so what we try to do with our methods in mind-body medicine is to really lower the stress level in the body.
Gotcha.
And then we have found that practice with this actually has helped so many people. Once you practice these techniques every day, after about 2 weeks, maybe 2 to 6 weeks, there's something called the carryover effect.
Uh-huh.
And that is when your body is feeling more relaxed, even after you've done the technique, even after you've done your 20 minutes or your 15 minutes. But day after day, that's lasting for 24 hours, the next 24 hours. It becomes part of who you are.
Changes your whole being.
Exactly.
Nice. So I want to go into another topic now. You work with the LGBTQ community, correct?
Yes.
What exactly is that?
So lesbian, gay, transgender, bisexual, and queer, what they call queer, queer can mean gender fluid. This community largely has been somewhat discriminated against in the medical community, because many doctors, many in the community, don't really know how to respond. And I think it's important, what I try to do is educate the fertility doctors, the practices, on how to be culturally sensitive, and also to educate gay, lesbian, transgender people on the options, because we have so many great fertility options now, whether they want children now or they think they may want children in the future. And I would love to see these people learn about these options early in their life, especially with transgender patients, because if they can hear about this and be informed before they go through a physical transition, what they call it transitioning, hormonally and surgically, we'd love to get you before you transition, so that if you are a male to female transgender patient, we can eventually use your own sperm with donor eggs. If you're female to male transgender patient, you freeze your eggs, and eventually we can use those with donor sperm. So there's a lot we can do.
Okay, so you're working with the fertility doctors who are going to help this group of people if they want to have children, have children. And your work, correct me if I'm wrong, is to try to get their stress levels under control while they're going through this process. Is that right?
You mean the doctors or the patients?
The patients.
The patients, that
You
is
work with
part,
them?
yes, and that is part of my work. The other part of my work is helping to train staff and doctors on what LGBTQ really is, to help them to understand that there is validity to a person's bone-deep sense of their gender identity or their sexual orientation. And I think exposure is everything. So the more they're exposed to it, the more comfortable they are with it.
The doctors?
Yes.
Oh, okay. Very good.
So we want to practice that's like culturally sensitive.
Right. So you're working with the patients as well as the healthcare practitioners
You have
that are
to.
helping the population become pregnant or whatever.
We need to work with the
so that they
healthcare
can
practitioners, yes.
That is awesome.
Yeah.
Could you tell the audience where you're located again and how to get in touch with you if they have any questions?
Sure. So my office is in Huntington. My office number is 631-397-0096. And my email address is my name, so it's BINABENISCH@gmail.com.
Thank you very much for joining us.
A pleasure.
It was awesome
Thank
having
you.
you.
Thank you.
And for those of you in the audience, you can see that Bina is tremendously sensitive, cares a lot about her patients. And if you're having trouble with fertility, please give her a call. She may be able to help, might make the difference. And for those of you who are watching us on Madhouse TV, we'll be right back. Those of you watching us on Cablevision, we'll see you next time. And just remember, if you want real wealth, join us next time on The Bridge to Health.
Thanks for watching.
Stay tuned. We'll be right back on MadhouseTV.com.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.